Yeah, we're actually behind Puerto Rico and Guam in healthcare funding, which is pretty phenomenal, public health funding. So the second piece of this kind of broader issues that we discussed, remember we had some specific ones and then a few overarching ones, this is obviously one of the more overarching ones, is looking at healthcare quality. So the Institute of Medicine does a lot of surveys and a lot of reporting examining health and healthcare quality. And what they state basically that high quality care is safe, effective, patient-centered, timely, efficient, and equitable. And so some of the measures that they use to evaluate this will fall in those areas. The U.S. healthcare, I love this quote, right, has been described as fragmented, overly complex, uncoordinated, inconsistent, and poor. And I think navigating the healthcare system is a significant challenge in and of itself. Okay, so relative to other Western industrialized countries, we know the United States healthcare is spending much more money, but we're getting less outcome from that. So we're spending a lot more money on healthcare related costs, but we're not seeing the outcomes that countries are spending a half or even a third of what we're doing, but receiving and finding some good outcomes with that. And so we know that in the United States alone, we see almost upwards of 100,000 people a year die from preventable medical errors, things that could be prevented through having an appropriate and efficient system like we talked about. This is more people that are dying from motor vehicles and HIV and AIDS, which is a pretty phenomenal number. And so relative to some of these things, Las Vegas, as we know, we always rank on the bottom of the good list and the top of the bad list. We've known that many times. But we're in the bottom 10% of major metropolitan areas with regard to quality and healthcare quality. We know that there's a lack of specialists in many areas. There's difficulties accessing them. And we know that we were ranked weak based on overall quality measures compared to the average of all other states. And the Kaiser Family Foundation does a lot of evaluation of healthcare systems. And they indicated and ranked Nevada 44th in the nation with an average of 8.9% nursing facilities deficiencies in 2012. And the US average was 5.98. And we know there's a huge nursing shortage as well here too. Most of the hospitals have 20, 30, 40, 50, even some over 100 openings for qualified nurses currently posted at our hospitals right now.